Fibroids are essentially a non-cancerous growth that comes from a layer of the uterus, the muscle layer of the uterus. And so we try to emphasize the non-cancerous growth because people hear fibroid tumor and suddenly get very alarmed. But pretty much any woman with a uterus can experience a fibroid. The incidence is about as high as 80%. So the fibroid burden is certainly higher in women of African descent. So typically African-American women or women who identify as Black women have a much higher fibroid burden, 2 to 3 times higher than their white counterparts. We don't exactly know why that is, but it's something that we see very consistently, be it Black women from the Caribbean, Black women from the continent of Africa, Nigeria, or Black women here in the United States. We see that it's pretty consistent.
I would say that my symptoms started probably around the age of 14 or 15. And I started to notice that when my period would come, I would have really heavy pain and I would also have blood clots. And I didn't really know or understand what a normal period looked like. So I just assumed that that was normal. So for me, it was really, really heavy bleeding every time I had my period, really, really strong cramps, even headaches, back pain. And even though I had a history of fibroids, or my mother had a history of fibroids, I still, really didn't understand what was happening in my body and really just made do with how my fibroids were or how my period was. So yeah, those were some of the symptoms for me.
For me, it's very similar. I was diagnosed in 2015 when I was 29. And I experienced extremely heavy menstrual bleeding. I passed a lot of clots, really big clots, and it led to me developing really severe anemia as well. So I ended up in the hospital. But like Tanika, my mother had fibroids, but she never discussed it with me until I was diagnosed. So I didn't know what symptoms to look out for. So I ended up in the hospital with severe anemia. My hemoglobin was a 3. And I know all of you probably know that a hemoglobin of 3 is not conducive to life. And I ended up with an enlarged heart because I literally had no blood left in my body. So they told me that I had a condition called cardiomegaly, which is an enlarged heart, because my heart was in overdrive, right? Because I didn't have any blood in my body. So fibroids nearly killed me. And it's just been an uphill battle since then. But some of the symptoms, like I mentioned, were really heavy menstrual bleeding, bleeding through my clothing, having humiliating accidents, pelvic pain, and blood clots.
Yeah.
For me, I experienced the first symptoms. So I had the heavy bleeding, but I had a lot of symptoms that were related to the size of the fibroids. So I found myself having to go to the bathroom often. Like most people can drink a bottle of water and be fine. That wasn't the case for me at all. And also experienced some other gastrointestinal issues. Sorry if this is TMI, but I was not regular at all. I started experiencing symptoms when I was about 22 years old. And it's funny because like Tanika and Nkem, my mother also had fibroids, but when I started to tell her what was happening with me, she suggested I needed more fiber and not to actually see a doctor. So for me, a lot of the symptoms, I had the classic bleeding, clots, not sure where that was coming from, but I was also having symptoms related to, well, what I later found out was the size of the fibroids because they were, quite frankly, taking over my pelvic area.
Yeah, and as I hear both of my teammates talk, I think about the bladder issues. Like always, I was always that girlfriend that's like, if we go on a road trip with Tanika, we're gonna have to stop at every rest area to go to the bathroom. In addition to what Nkem was talking about, I've had 7 blood transfusions due to low iron and anemia because of fibroids. So it really is something that feeds on your blood, and obviously Dr. Chambers can speak to this more, but really something that feeds on your blood and really drains you. That's the reason, you have low iron.
I can just talk kind of briefly to kind of highlight a few of their points. So very interestingly, they touched on so much just then. It was almost like reading a textbook from the medical side of things. If your mother has fibroids, you're definitely more likely to have them. And the glaring symptoms are going to be that heavy bleeding, that pelvic pain and kind of pain with cramping. And then what Amber described is something that we call bulk symptoms. It is truly the bulk and overall burden of the fibroids in your belly that can kind of mimic being pregnant. We even kind of refer to the size of a uterus, a fibroid uterus, the same way we refer to a pregnant uterus. So we can say, oh, this is a 30-week uterus full of fibroids. And it manifests like that. It's like being perpetually in your third trimester, which is why there's frequent emptying of the bladder and then constipation associated, because that's truly pressing on your bladder and pressing on your intestines. And then treatments, there's plenty of options. What we've mentioned so far are treatments for symptoms. And so that's transfusions. We are doing nothing to help with those fibroids. We are just restoring you so that you can live higher than a hemoglobin of 3. A normal hemoglobin is 12 or higher, really. 3 is significantly low, so low that her heart had to pump that much harder, which is why it starts to grow, and it grows like any muscle that you work out, and that makes the heart larger, and that causes the heart to eventually kind of fail. And so that's what she described. And so all we've touched on are the symptomatic pieces, which can be hormones. It can be medication to help with the pelvic pain and the pain with cramping. It can also be, obviously surgical interventions. Sometimes we block off the blood supply to the uterus, called a uterine artery embolization. And that sounds very extreme, but if you're trying to decrease the bleeding, that's another option. The very, very last resort, that's, beyond just removing the fibroids themselves or taking like a birth control pill or a hormone to stop the bleeding or to regulate your cycle, would be removal of the uterus itself, which is the last resort, because it's surgical.
Pica is a condition I also had associated with fibroids, where it was, I guess my definition of it was my desire to have ice all the time. I wanted soap all the time. And the way it's been explained to me is that because my body was lacking so many other different nutrients, then it sought out other things that I should consume, I guess. Yeah.
You're exactly right. Pica is very common in people with anemia. And so the idea is that your body is so smart that evolutionarily it decided to trigger a desire to just eat kind of random things. And sometimes it can even be a desire to eat something like dirt. And most commonly it's ice, but it's a desire for your body to get those minerals that you are so severely lacking. Your body cannot make new red blood cells without iron. And iron is a mineral that's found in a lot of these things, mostly in red meats. Why we don't crave more like red meat, I don't know, but it can be like eating cornmeal. Some people can snack on things that are not actually edible, like even soap. And so it can be very odd, but most commonly it's characterized by ice. It is not a direct result of fibroids. It is a direct result of anemia itself.
So for me, I don't know if this is necessarily considered a treatment, but since I've been diagnosed in 2015, I've been on different birth control to manage the bleeding. So I was initially on oral contraceptives. That worked for about a year or so until it stopped working. So they switched me to the Depo-Provera shot. So I've been on the Depo-Provera shot for about 3 years now. I was initially supposed to be on it just for 2, but it has improved my quality of life so much, and I know that's a false sense of reality or a false sense of security, because I know that it is not treating the fibroids, it's just managing my bleeding. So I know that at some point I can't be on the Depo shot for much longer. So I know I need to discuss with my physician about what those next steps are. And I know I'm going to ultimately need surgery to remove the fibroids. So that's where I'm at in my journey. Still on the Depo, still trying to figure out what my next steps are with regard to treatment.
So for me, I have now had 2 surgeries. Most of my treatment has been surgical. To Nkem's point, I did spend some time on Nexplanon to deal with the heavy bleeding. But ultimately, for me, I had a laparoscopic myomectomy to move the fibroids inside my uterus back in 2017. Unfortunately, I was so anemic the first time around, I wasn't a candidate for any other surgery. I just lost so much blood and the doctor wasn't comfortable doing it. But even that brought tremendous relief for me. And then in between surgeries, I used birth control. So I still have an IUD, even after my last surgery, which was 3 weeks ago. I had an open myomectomy, and that really attacked the size of my uterus. So during the first surgery, they really couldn't get any of the fibroids that were on the outside of my uterus. And Dr. Chambers, I leave all that to you. I'm not an expert there. But what I do know is that the second surgery is when they could take the bulk of the fibroids out, 24 in my case. And even still not even being fully healed, my life is dramatically better. So much. I can't even I can't even begin to describe, but even in pain, I still feel a lot better.
Unfortunately, and fibroids do grow back. It's hard to say if the exact fibroid cell itself is like growing again. We do not say that someone is relegated to perpetual surgery, because with every surgery, you are at a higher risk for scar tissue, and just the risk of the surgery become increasingly higher. And so we don't try to do multiple surgeries back to back unless we absolutely have to. Having said that, typically when a woman is beyond her childbearing years, or she has completed her family and had the desired amount of children that she desires to have, the recommendation would be for a hysterectomy for definitive treatment. Now, if you can get to menopause, which on average is the age of 51, with the absence or the sudden decrease of your endogenous or kind of natural estrogen and progesterone levels, most fibroids do shrink. And so women don't necessarily need that. Additionally, you stop having periods, and the bleeding tends to be the most bothersome symptom. And so with kind of a transition into menopause, a lot of folks will just say, if they're not bothering me, I won't bother them.
Yeah, and my story is very similar to Amber's story. So I've had 2 myomectomies. One of them was what doctors call an open myomectomy, where it's the full bikini cut. And my second one, doctors were able to go in through my belly button and remove the fibroids. Before that, I would treat my fibroids, like the other ladies have suggested, through birth control. But I am Jamaican. So in Jamaica, there is always a remedy for anything that's going on in your body. So I feel like for years, I would take extra fiber and prune juice and make sure that I drank ginger tea all the time to lower inflammation. So I think there are these like cultural things that, get passed down through your family that your parents seem to think can kind of cure these ailments that we have in our body. But yeah, I have used birth control. I've also used something called tranexamic acid, which helps to stop bleeding or heavy bleeding. So that has also been helpful to me. It is very disappointing, I'll say, that I have had to have 2 surgeries within the span of 5 years, and I still currently have fibroids right now. And my last surgery, they weren't able to get all of them, so it wasn't that they necessarily grew back, they just weren't able to get them. So it is disappointing to know that, there's really no definitive reason why they grow in the first place. There are no answers around if we're doing anything that contributes to their growth. There's a lot of conversation around diet and estrogen and the chemicals that we put in our body, but there's not a lot of scientific data around that. So it is just a frustrating condition to have because there's not a lot of things that you can pinpoint about it. And there's not a lot of treatment options that are outside of surgical procedures. There are companies, obviously, that are working on more pills and things like that, but it does leave the patient in this like daunting, burdensome position when you really can't figure it out and you don't have the answers, and doctors are kind of like, so yeah.
I can definitely define normal bleeding, because that I think is super important. And that's really what I do as like an adolescent gynecologist. My whole goal is to interact with girls when they start their periods so we can say, hey, this is normal. Please, please reach out to us if you go on either spectrum, if we're absent periods or too heavy. And so the idea is that you really shouldn't bleed longer than about 7 days. Bleeding longer than that time period sets you up for anemia. And there's some women that will come in, they'll say, I've been bleeding for 2 months. And that is far, far too long. The other thing we kind of try to use as a surrogate marker for heavy bleeding is changing a menstrual product. Now we have to understand that menstrual products vary. So you've got your Super Plus tampons, and you have your light. So it kind of depends on what your flow is during that time period. But the suggestion and idea is that you should never be changing a product more often than once an hour. So when you're changing something once an hour for more than 2 hours, that is too much. That's suggestive of too much. We also use blood clot size to help us determine if the bleeding is a little bit too heavy. And typically a blood clot that's larger than a quarter is abnormal. And a lot of women with fibroids will laugh at a quarter. They're like, ha ha ha, that's my smallest blood clot, you know. But really, it would suggest that your body is forming blood a little bit too rapidly, and the fact that it's even allowed to pool in such a fashion that it can get as large as the palm of your hand or a dinner plate even, suggests that you're bleeding far too much. And so I'll kind of yield to the girls so that they can speak about some of the lifestyle changes that they've made. But that's kind of the parameters for normal bleeding.
Yeah, and I wish I had known that. I wish I had known Dr. Chambers a lot earlier, because that definitely wasn't my experience. Definitely have had clots that are larger than a quarter, and definitely have changed my pad more than once an hour. I would say probably every 20 minutes. And obviously that's what led to my anemia. But I think to get to the point of your question, Nadia, really I have made so many lifestyle changes because of fibroids. It's the reason that throughout college, throughout my adult life, I never wore white. I never felt comfortable, even though I might not have been on my period at that time. I just never felt like I knew when it was coming. I never felt like I could manage it if I was out and something happened. So I just made sure that my life always included having a pair of underwear with me, a pair of leggings with me. I always had like my backpack, like my girlfriends know me for having my backpack in the backseat of my car. I've never bought a car with leather seats, or I should say cloth seats, because leather is so much easier to get blood out of. I know every mattress cover there is in the world that isn't, easily stained or can get stains out of easily. So when I think about all these lifestyle changes, once again, it goes back to this condition feeling so daunting. Even when I think about dating and relationships, before I got married, like I would never spend the night at a guy's house, and it would always be like, why are you weird? And, it put pressure on some relationships that I can remember, but I just always wanted to be in the comfort of my own home, not knowing what could happen. So always having pads with me, always being cognizant of the products that I bought, and never white, never feeling comfortable. And, as a college student, you have Labor Day parties and 4th of July and all the things that are social where, white comes into play. And I wasn't being a participant with those.
So I know that definitely symptoms and issues with like a depressed mood and even depressive disorder can be more common in women who have any type of chronic illness that majorly impacts their life. So if they're thinking about it in the majority of situations, which Tanika very eloquently kind of discussed, you know, that's going to impact kind of your well-being and your ability to participate in things and the way you interact with others. That can lead to either depressed mood or a dysphoric kind of mood, or even kind of exacerbate or potentiate like depression at baseline, which is very difficult. But when you consider just kind of psychiatry and the ways in which we diagnose disorders, disorders are based on impacting your life in a meaningful way, making it difficult or impossible for you to carry out your daily activities. And that is how we transition from something that's just kind of a little bit of a symptom or condition to a true disorder. And so it would make sense that someone would feel, you know, a depressed mood or have some sort of mental illness or, you know, mood changes related to a significant fibroid disease or anemia.
So for me, I feel the fact that I still am struggling with fibroids, I think I'm the only one who hasn't had a surgery at all in the 5 years that I've been struggling with this. And I just feel sometimes that I don't have a sense of control, you know, over my body. And that gives me so much anxiety and so much fear. Because I just don't know. Like, I don't know what's going to happen. You know, it's that fear of the uncertain and the unknown that gives me so much anxiety and just, I wouldn't say depression. I don't think it's to the point where I'm depressed, but just really, really, really anxious, you know. And I told you I'm on the Depo shot. I literally feel like I'm a fiend for the Depo shot. Like, I'm a slave to the Depo shot. I have to take it every 3 months. And because I don't want to go back to that traumatic experience of when I was first diagnosed in 2015 of needing a blood transfusion, almost falling over with every step that I took, whenever that 3 month mark hits, I'm like, I need to call the doctor. I need to make the appointment. Like, you know, I need this shot. Like, I feel like I'm a slave to it. You know, and I feel like I want to take control back of my life. I don't think I'm in complete control right now. So that's why I'm really in the process of talking about it with my doctor in partnership, trying to come up with the next step for me in terms of treatment.
Mental health wise, there were times where between the pain and the bleeding, weekends were happening and like I was scrolling social media and all of my friends were out and I just couldn't do it. I just knew that I would be angry or like not the fun person in the room, or even worse, I would fear that I would have an accident like at the club. Like, that'd be awkward. We got the VIP section and here comes the girl bleeding on the couch. So never wanted to be that girl. So I did experience times where I just felt like I was missing a lot of my time. Like, I was missing a lot of the joy and just kind of watching life happen. I'll say some of the things that I did to kind of get around that. I started hosting more. Like, there was a time where I felt most comfortable in my home. And so I would host game nights and I would find other ways to socialize when I didn't quite feel comfortable maybe going out with friends or didn't feel like doing the really big thing. And so just kind of like finding new ways to get the joy that other people experience. I think that was my way to get around until I started like being treated.
Yeah, I'm so glad that Amber and Kim brought up those two great points about anxiety and feeling like you're missing out, because it's truly how you feel. You truly feel like because of this condition, you're just missing out on life. And that does bring you a level of anxiety. It does give you this feeling of up and down, happy 1 minute, sad 1 minute. For me, I really think that when you are on the bathroom floor in fetal position, bleeding for days on end, and it's not stopping, and you're in pain, and you have to go to work the next day, and you get another doctor's appointment, it just becomes increasingly harder to bear. And I think for me, it came to a head when I realized that I had to have my second surgery. And I knew that I became so desperate, I started to seek everything. So I went vegan for a while, and then I would try all of these juices and herbs I hear about on social media. And when none of that was working for me, I got to a point where I felt like it was depression, because I could not understand. And mind you, this is the time when I had already started the White Dress Project. And I couldn't understand, like, I'm supposed to be like the fibroids lady, like the patient advocate of patient advocates for fibroids. And like, I have to have a second surgery. I have all these resources. And you mean to tell me like I couldn't figure it out? So that really did bring me to a low, I would even classify as depressed state. And because of that, I figured out that I had to seek professional help. So that was what I did for self-care. And ever since I have been going to therapy, it has really allowed me to see, to Nkem's point about feeling like you're in control of your body, it has allowed me to see that, no, you're not losing control. Here are some things that you can do to feel that this you're going through this experience in, and it has given me more purpose about the White Dress Project. So, you know, the state of depression I had to get to really has allowed me to recognize the purpose in all of this, and the need to share our stories and help so many women. Yeah, I can go first on that one because I'm in it right now. I've had 2 surgeries, and as Dr. Chambers talked about earlier, the more surgeries you have, the more potential for scar tissue. So I have gone through 2 rounds of IVF and have not gotten pregnant. And that's also really emotional because it's just not how you expect it to play out. You know, like I was supposed to go to school, get married, have a baby. And when it doesn't pan out that way, there are all sorts of questions that come that you can't answer. To answer your question though, I feel like I would have definitely gotten more education around freezing my eggs. And just taking into account all of the dietary things I could have, bone broth and turmeric, and I always have my ginger and lemon tea, because those are the things that that at least as far as I know, you know, kind of quell inflammation. So I want to, you know, and keep my scar tissue down, basically. So yeah, it hasn't panned out the way I wanted to, but I'm not hopeless. I'm still filled with hope. I still know that in some capacity I will be a mom. I just get upset at fibroids sometimes because it just really has like, monkey wrench is like an understatement. So I wish I had known more about better taking care of my body. I wouldn't have had so many boxes of pizza in college. And just how important a healthy lifestyle, healthy diet is to your overall body. And I would have frozen my eggs much earlier.
I think if I had known about fibroids earlier, when I read that question, I actually thought about, what if someone had taught about fibroids in sex ed? I think I would have taken my heavy bleeding more seriously. Growing up, my family, the women in my family would always say, oh, it was just kind of what we had to experience. It was very much framed as like heavy bleeding was normal, that it was a rite of passage even, and this is just what you do. Had I known that heavy bleeding was a symptom of something that was a little bit more wrong, I think I would have been more aggressive about being seen for the heavy bleeding and pushing, even when I was seen, for more to happen. When I first started going to the gynecologist about my heavy bleeding, they immediately just hopped to birth control, and that was kind of that on that. The second thing that I think about when I read the question, what would you have done differently had you known about fibroids? I think had I joined the White Dress Project family earlier on in my journey, because my journey in total was about 10 years until my first surgery, I would have pushed back a little harder when doctors said to me, something that I commonly heard was, well, if the fibroids aren't bothering you, then you shouldn't bother them. And I kind of thought, well, they know what they're talking about. They know what's best. And certainly am in no position to argue about that clinical treatment or that treatment plan of watchful waiting. But for me, I would have pushed back a little bit more as the years went on, because I do know now, being at the end of a long journey, that an open myomectomy was the really last stop for me, because my fibroids were so large, and because I still want to try to have a family. And so, yeah, I would have pushed harder, because I think about what I went through and the experience of being cut open vertically and being in the hospital for 5 days. Sometimes I feel like it didn't have to end that way, and it might not have ended that way had I pushed a little harder.
For me, it's very similar to what Amber just mentioned. If I was aware of the telltale signs of fibroids, either whether it's from conversations with my mom or just me doing my own research, I think I would have definitely been more proactive in addressing it. I would have gone to the doctor earlier. I would not have waited until I was nearly dying to go see the doctor. And I think I'm at a different point in my journey than Tanika and Amber. So they're both married, and I'm not. That's something I've desired for so long and that I continue to desire. And this may sound really ignorant, but one of the reasons that I've been pushing getting surgery was because I kept telling myself, I'm just waiting for God to bless me with a man, a husband first, and then I can get the surgery so that I can have a baby right after. Because, you know, we were talking about how they can grow back, right? Like I'm not someone who wants to constantly get the surgery without having kids, right? So that's been, you know, one of my fears in going forward with the surgery. Yeah, so definitely, I would have definitely been more aggressive about, you know, just going to the doctor. You know, now I feel like I'm more proactive in my health. You know, I get my wellness checks every year, and I make sure that I'm my own health advocate. I make sure that I'm an informed patient, and that's something that the White Dress Project has taught me. Right, like to be your own best health advocate, because we're in a unique position to be able to do that. We know our bodies better than anybody else, right? So we need to be armed with questions and with our concerns with our doctors. So I think in terms of, you know, self-advocacy, that's definitely strengthened in my health journey, partly because I'm part of the White Dress Project, which has taught me the importance of that.
So I can definitely kind of speak to that. So when you're in a position like Amber mentioned, where you know you have fibroids and your physician is saying, not yet, ask a clear when. I would ask a clear when. If not now, when? And when do I need to come back? What are my alarm signs? I need to know my next step, because that will, one, give you some guidance so that you know you feel more empowered and you feel like you have a little bit more say-so in your future. But it also clarifies that your physician is not just pushing you off. They have a second and third plan, because a good physician has conservative plan, more aggressive, and then fertility happens kind of plan, a sudden thing happens. You know, we have to think about like 4 different case scenarios and have a solution and answer for all of them. And that's not too much to ask. A lot of people also And I think this kind of depends on your upbringing and some of your characteristics. One of the other features that I've noticed, especially of women with fibroids, as Black women, we are often afraid to appear aggressive or confrontational or argumentative. And I have seen, you know, even a front desk person or an administrative assistant or someone imply or suggest that an African-American patient or Black woman is more aggressive. And then I'll go in the room like, no, she's not. She just asked you a question. Like, she genuinely asked why she had to be here or why you wouldn't give her her medicine here, which you should be capable of answering if you value her and believe that she deserves the right to know the answer. And so being your best advocate is also having a decent lens of suspicion and having a willing heart to say, I disagree with you, or my heart just doesn't feel like you're listening to me. I will choose to look elsewhere. A second opinion is not a bad word. It is not a bad thing. A clinician who is evidence-based, who is confident in their plans, will never be offended by a second opinion. Because if it makes my patient feel better about the treatment plan that I've offered, she says, you know what, I went to 3 different doctors and they all agree with you. I feel good about this. I feel good about the decision I'm making. That is a more informed patient. That's the patient I want to operate on. That's the patient I want to take care of for years and years to come as we partner through this journey of dealing with and managing fibroids. So some of the baseline disparities that certainly impact our patients with fibroids are going to be the perception that Black people and Black women don't experience pain quite as much. So that's definitely a huge factor. The tendency to go more extreme or to suggest a sterilization procedure versus a fertility sparing procedure is one of those other things. The lack of insurance or underinsured kind of population as it relates to fibroid burden is a huge factor, because you're not going to seek medical care if you cannot pay for it. If you're like, you know what, if I could just toughen through this one more period, I know that maybe next month I'll have better insurance, or maybe in 6 months I'll be able to do, because you know that these fibroids have to be taken care of. You know that this is a chronic process. And so one less month of a medication you may need to take for 3 years to you might be a reasonable exchange. And so when you're underinsured, when you're potentially underinformed, and when you're being counseled towards higher non-reversible options, all of that leads to significant disparities.
And I just want to mention a point about how we choose our doctors. Like, it's such an individual process. When I share my story, that one of the doctors to first to deal with my fibroids was a male. And the thing that he said to me that was so impactful, that your uterus is too enlarged, you have too many fibroids, you are not going to bear children. And I hesitate to repeat it, to back out there in the atmosphere, but just to illustrate what he told me, you know, not going to bear children, you might as well go ahead and get a surrogate. And he was a visiting doctor at the hospital that I went to, and he was from a rural part of Georgia. And after I learned all of that about him, I realized that it was just his experience. Like, he had never seen someone with my size uterus and the amount of fibroids that I had. So that's why it's so, so important. I love Chambers said that getting a second opinion is not a bad word, because I feel like there's so many women who are just look at the white coat as this level of authority, which they are, right? They have more knowledge about the topic than we do. But really, we have to become the best advocate for ourselves. Because at the end of the day, doctors have thousands of patients, and they're not thinking about you every second of the day. So any good doctor is going to encourage you to get multiple opinions. So I love the fact that she said that, because if I had that for my first surgery, I probably been recommended a hysterectomy, because my first surgery, I had 7 fibroids taken out. So he was just like straight out of feed. So he didn't know what to do. And as a doctor, I feel like they are in the position that I can't not tell my patient to do something, but that advice is not always the best advice.
When I think about the disparities that I read about in articles, what Dr. Chambers talked about, and I think about my own personal care journey, I think about feeling like I was second guessed at every step of the way. So certainly from 22 to now 35, well, almost 35, I would go to the doctor more. As I learned more about fibroids, I became more active in my journey. But it would look like a doctor telling me, you know, would you even be here if you hadn't seen your ultrasound report? Or are you really sure that you feel that pain? You know, is it really pain that needs to be treated? Is it something that you would live with, or is it something that, you know, you're just kind of going for this? And to me, that was something, and I've talked to many women about their fibroid journeys, and it's something, quite frankly, an experience that I share with my Black sisters. And when I have talked to non-Black people who've had fibroids, I just haven't heard that level of second guessing the things that they are coming to the doctor for. So we're thinking that we're doing everything right. But we're going to the doctor, we're bringing our journals to the doctor, we're asking the questions that we've either talked to our sisters about or read about online, and we're being doubted and questioned. So I don't know that that helps the conversation, but when we think about disparities on paper, that's just how I experienced it in real life.
Right. For me, I've heard a lot of African-American women saying that I will only go to a African-American doctor who's female. What I'm about to say, I'm not negating at all the racism and the racial bias that exists within the healthcare system that perpetuates health disparities. I'm not negating that at all. I'm not disputing it. I'm not discounting it. But in my personal experience, I've had an African-American female doctor who was very condescending to me. She was not attentive to me. She was not receptive to me. She dismissed my pain and my concerns and my fears. You know, so I really felt devalued. I remember one time I was getting an ultrasound by her, and she said, "Your uterus is massively distorted." And, you know, in the moment, I was just shocked to hear that. And I asked her, wait, what do you mean by that? She's like, just what I said. And I did not know how to respond to that. You know, I was just like, okay, you know, and I endured that for another year, you know, and I wish I found the current doctor that I'm with sooner, because it's like night and day. Right? Like, he's an Asian male doctor, and he explains everything to me. He draws everything out for me. He understands me. He's empathetic. He's compassionate. So when I'm looking for a doctor, race, okay, it may play a role, but I think equally as important when you're trying to find a physician that's the right fit for you, other qualities such as compassion and empathy, understanding, active listening, are equally important qualities when you're looking for a doctor.
That's such a great point, Nkem. I heard one of our partner doctors say that you should always ask your doctor, would you perform this procedure on your sister? Would you want your mom to get this treatment plan? And just see how they interact. And to your point, while, you know, your experience has been different from Amber and I's, I think it's also important to recognize that finding your doctor is such an individual experience. And I liken it to dating. Like it is, you know, we got to find the one, and we have to find the one that is best suited to care for me and is going to have the most investment in my care. So the White Just Project, we are a nonprofit organization, and really our mission is to support women who are suffering from uterine fibroids. We are all patients, and we understand where women are coming from who go through these bulk symptoms of fibroids. I think another thing that we often think about is the mental impact that this has on you, someone suffering from fibroids. I read something the other day, and I'm not sure if it's, actually I heard it, I'm not sure if it's published yet, that fibroids is almost or comparable to a woman, financially comparable to a woman who is suffering with cancer. And to think about the financial burden, to think about the psychological burden, I think we just wanted to create an organization where women felt supported. Women understood that sharing theirs are powerful. And women understood that unless we share our stories, we really don't get to a place of healing. I have understood that from starting this organization, it has really led me to my purpose, and it has really led me to my healing. And I think that is so powerful for women to understand, because the moment you share and you get like a, oh my God, girl, me too, like you automatically feel like you have contributed someone being further along in their journey. And so our mission is very simple. We support women suffering from uterine fibroids. We encourage women to be their own best health advocate, and we encourage women to share their story. It's so, so powerful when you share, because it leads to your healing and you are aiding in someone else's healing.